The opinions voiced in this podcast are for general information only and are not intended to provide specific advice or recommendations for any individual. To determine which strategies or investments may be suitable for you, consult the appropriate qualified professional prior to making a decision. Today's guest and their company are not affiliated with or endorsed by LPL Financial. So thanks for doing this. So let's go ahead and get started. Do you mind telling me a little bit about yourself, a little bit of your background?
Sure thing. Yeah, first and foremost, thanks for having me. I will say that I'm originally from the little big town of Vega, Texas. So rural upbringing. Vega is just west of Amarillo, about 30 miles or so. And so from there, from Vega, went to Kansas Wesleyan University, and that's where I graduated from with a degree in athletic training, exercise science. And I played football there, so go Yotes. From there, I did a brief athletic training internship with the Cleveland Browns. That was fun and interesting in 2014. And then lived in Houston for about 2 years, and 2 years was about 1 or 2 years too many, and decided to get back to my West Texas roots. So Abilene was always kind of a home away from home, and been here since 2018.
Okay.
Mm-hmm.
So what got you into more of the medical line then? Because obviously the medical care mission is not your first kind of foray into the medical scene.
Yeah.
So what kind of led you into that path?
I was thinking about this leading up to this, and so in high school, being in a 1A school in Vega, sports are king, and so very much subscribed to that. And so with that, I always thought that I would be a coach, actually. I always thought that I would end up being a football coach and a history teacher like most 1A school coaches and teachers. But through sports and maybe me being a little bit of a klutz, I got injured a lot. So,
Okay.
I remember so many different injuries that I had that made me go to Amarillo for medical care. And so I remember being, for whatever weird reason, just fascinated with medical facilities and doctors and nurses and the works and seeing the cool x-rays up on the wall. And so I always knew that I wanted to do something that was sports related at first, and then transitioned into a little bit of interest in sports medicine. And so that's when I ultimately decided to go into athletic training and sports and exercise science. And then once I got into that, I was fortunate enough to do some internships with orthopedic surgeons and their physician assistants. And so I wanted to either consider PT school or PA school. And then that's when I got into to kind of pad my resume for those applications and stuff. That's what got me into working in the clinical setting. And then that's what exposed me to medical practices and ultimately medical practice management. So it's been a long, windy, weird road, potentially, I guess, starting off with me being a klutz and getting injured a lot. But at the same time, it's just interesting how, one door closes and another one opens, and you just kind of develop as a person, I guess. And so ultimately, that's how I kind of transitioned into healthcare and then ultimately healthcare management.
Okay, great.
Mm-hmm.
So how many years have you, because this is the end of your first year at the mission?
End of the first year at the mission, yeah.
Okay, and so where were you before?
So I was with Hendrick Health from 2018 up until 2024, so going on 7 years.
Okay. Would you say that the relationships that you made there has led really well into this, or has benefited you since being at the mission?
Tremendously. So how I first got wind of the medical care mission and the great things that they were doing was actually I was fortunate enough through Hendrick to be a loaned executive for the United Way and their annual workplace campaigns that they do to raise funds for nonprofit agencies that they partner with. And so in learning about the partnering agencies that the United Way supports, of course, one of them is the medical care mission. And so through that partnership, that's ultimately how I got wind of it. And then at the same time, with me working with physicians in the practices and things along those lines, oftentimes we would have patients in that setting that lost their insurance or fell on hard times and still needed medical care but couldn't afford certain things. And so oftentimes we would set up a referral pathway to the medical care mission. So very much the relationships, the overall understanding as to the impact that the medical care mission was having was evident since I've been here in Abilene in 2018.
So would you say it's been the way that Hendricks and the medical care mission kind of work, it's less of a trickle down into from one to the other, and it's more of a cross flow. Like basically, people maybe have the insertion point in their health that they start with the medical care mission and end up receiving services at Hendricks,
Mm-hmm.
or do you see more one way than kind of going back and forth?
It's a bidirectional for sure, and
Okay.
it completely depends. It's going to be case to case, case by case. Um, Oftentimes patients of ours who do not have medical insurance but need access to affordable health care and prescription assistance and things along those lines, will get them into the clinic. But our primary bread and butter services are primary care. And so sometimes if we, evaluate a patient, determine a little bit what we think is going on, but they need, specialty services, then of course that would result in a referral to some of the amazing Hendrick network physicians that they have, and or special testing, as well as procedures that Hendrick has available. And we're really fortunate enough. Hendrick is a unique hospital system that's also a Christian-based nonprofit system that also does some great things and has great programs for patient populations such as ours at the Medical Care Mission, which of course is uninsured, low-income adults here in Abilene. So many times, oftentimes, our patients will actually qualify for certain charity care programs that they have through their resource assistance program. So it's very much bidirectional. Sometimes, they'll send a patient to us. Sometimes we'll send a patient to them. And so it's a very great relationship that works both ways.
So what's kind of the endpoints of where people can receive care for the mission? Who do they help? What kinds of things can they come into the mission for?
Sure. So our primary services that we offer, like I mentioned, is primary care. So primary care under that umbrella is a lot of things. Primary care covers preventative health services. So oftentimes, everybody recommends getting established with a general practitioner or primary care family physician for their annual checkups, their annual well-woman exams, their annual physicals. And that's ultimately just to make sure that they're taking care of everything they need to from a preventative health standpoint, making sure that their vaccines are up to date, their cancer screenings are up to date based on their age, making sure we're kind of peeking under the hood and looking at different lab markers and things along those lines. So primary care, preventative health. Another aspect of primary care is, of course, acute illnesses. So your cough and your flu season, which we're in the midst of right now, and it's likely only continue to get worse, I'm sure, as we enter December and January. So we can see patients for those types of visits. And then another big aspect of what we do, and really the bulk of what we do day to day, is chronic disease management as part of primary care. So as we all know, right now in the U.S., we're very challenged when it comes to basically metabolic syndrome, which is patients that have difficulties with controlling their blood sugars, also known as diabetes, difficulties managing their blood pressure, difficulties with high cholesterol, difficulties with weight management, and things along those lines. And so through our programs under the primary care umbrella, we're able to get those patients in, establish care with the doctor, and making sure that we're getting them on, the lifestyle regimen that helps with those, as well as medications to supplement as well, in hopes of treating them now so that, those conditions don't worsen over time and develop into an acute emergency, and things along those lines. So primary care, under that umbrella, you've got those three primary things. That's our bread and butter. But a huge aspect of what we do at the Medical Care Mission that we are incredibly proud of as well is we have our prescription assistance program. So it's one thing to, see a patient, but also prescriptions are very expensive in, the U.S. right now. And so it's another to actually get the medications they need to treat whatever is ailing them. So through our prescription assistance program, we're able to get patients, life-changing critical medications that they need for controlling diabetes, controlling hypertension, and those things pretty well at free of charge. We're able to get them, if they're sent directly to their home, it's $0. If they're processed through the clinic, it's $3. And this is, we're talking, 4 to 6 months worth of insulin to keep their blood sugars down. and things along those lines. And even some amazing medications to help cure, like hepatitis C, which that med, believe it or not, is like $70,000, and we're able to get it to patients
Wow.
for $3.
Wow.
So we're very proud of that prescription assistance program. And actually, I was looking at some of the numbers most recently, and this last fiscal year, the total retail value of the medications that we save for our patients was north of $7 million.
Wow.
And the year prior, it was $5 million. About the same patient load, just increasing in prices. So,
Really?
Very proud of that program.
So how is having the medical care mission across from Hendrick beneficial for them?
Beneficial for Hendrick.
Yeah, for Hendrick. So, I mean, the two work rather symbiotically, even though they're not entirely connected, obviously, through. So, what allows that relationship to be beneficial on Hendrick's side? When it seems like you're stealing patients. I mean, really is what you're trying to do.
No, we're not stealing patients. I wouldn't say that. No. So, with us being out on the north side of town, I would say first and foremost, geographically, that makes the most sense for us because the vast majority of our patients and the patients that we're in the population that we're serving comes from the 79601 zip code. Probably about 70 to 80% of our patient population, actually. So it makes all the sense in the world for us being on the north side, given the population that we're serving. And then from Hendrick's standpoint, the reason why we're happy to be there supporting Hendrick and supporting our patient population is because if we're there and we're providing access to affordable, high-quality primary care, chronic disease management, if we can get those patients in and remove barriers when it comes to accessing healthcare, we can more effectively on the front end help them control their diabetes, their blood pressure, their weight, in hopes of preventing them having to rely on the ER. So oftentimes, if patients don't have access to a charitable clinic like the medical care mission, what will naturally happen is that they'll delay their care, or they'll potentially inappropriately utilize the emergency rooms, which of course is the most expensive care delivery program that's available in the U.S. And so it benefits Hendrick, of course, for us to be there providing access to care, preventative care, namely, in hopes of preventing patients having to go to the ER more readily for their primary care needs, their prescription needs, and hopefully not, but emergent needs as well. And then on the back side, Hendrick does a wonderful job of caring for the patient through the ER, through the hospital, but oftentimes, Hendrick will need placement for that patient after said hospitalization. And so we work tirelessly to ensure that any patient that is discharged from Hendrick facilities, they have a home for their medical care needs thereafter, in hopes of, us allowing them access to our programs, access to our prescription assistance program, namely, in that they don't have to, readmit to the hospital, to the ER. So it works both ways, and that's how, Hendrick benefits largely. But they are incredibly supportive of us and our services that we provide to the community.
How long has the medical care mission been doing this?
The medical care mission was established in 1983. So believe it or not, going on 42 years of serving the community.
So has it always looked exactly like this, or how has it changed over the years?
It's a good question. I've been there for a year, so.
Right. Well, I just mean through through your work and kind of looking back over records, what they've done, how they've benefited the community, how they has it changed much, or obviously the mission's probably always been the same, but how has care maybe changed, and maybe someone's interaction or something that they received from the medical care mission 20 years ago, would it be similar, or maybe kind of different thoughts of what they would be receiving and walking into today?
Sure. Yeah, no, that's a great question. I will back up real quick to 1983, what spawned the idea behind the medical care mission. Okay. And so it's amazing to think back at that time. There were three physicians that noticed that there was a large portion of the population that was flooding the emergency rooms inappropriately for prescriptions, for basically primary care needs. And unfortunately, that was kind of creating bottlenecks in the ER and preventing, some people that truly were having emergencies to quickly be seen and things like that. So out of the kindness of their heart, they decided to go ahead and act to that community need, and that's where the medical care mission came from. Those three individuals, those physicians, were members of the First Central Presbyterian Church. And so that's where our namesake comes from, in that, we are one of their mission fields, so to speak, and they're incredibly supportive of us and our services that we provide to the community. And actually, one of our founding fathers, if you will, one of those three physicians is a gentleman by the name of Fred White, who actually is still a practicing physician here in Abilene, owns his own endocrinology clinic, and he generously still to this day volunteers at the medical care mission once a month. So love having Dr. White on site, and he's just such a wonderful man to get to know. So that's kind of a little bit about, the history of the PMCM, the why, and things along those lines. And, the funny thing is the story goes, of course, I wasn't around at that time, not only born in Abilene, but I wasn't even born yet. But the story goes that, of course, they had this grandiose idea behind the medical care mission, but they, of course, didn't have a clinic yet. And so Dr. White and his fellow colleagues literally were providing care, driving around out of the trunk of their car, kind of a thing, for the longest time, until, of course, they found facilities or a clinic to get started. And so from going from the providing care out of the trunk of your car to where we are now, some drastic changes have taken place. But, the medical care mission, I believe, has had, we are at our currently the second location that the medical care mission has been at. Historically, I want to say it was off of Highway 80.
It was next to the old TSTC building.
Right, and that's when you were there, right, as a student observer, I want to say.
Yeah.
And so a lot has changed in the form of, I guess, the clinic and the buildings and things along those lines, the people that have generously been a part of the clinic. But at the same time, our mission has held true to that for the past 42 years. And I will say just a few differences as well as how things have morphed. Of course, in the healthcare world, historically, when they first started in '83, we were on paper. Now we're, as of, I guess about 2015 or so, we've been on a medical record that we utilize for keeping track of patients and, their records and their prescriptions and things along those lines.
Great. So with it kind of starting in the back of a car, essentially, or out of the trunk of a car, some of the initiatives that you were starting is kind of getting us back to the trunk of a car care. Would you agree?
Which initiatives are you referring to?
So you guys are not tied specifically only to the clinic itself. You have also had the goal and began to work in outreach to other communities, or not other communities, but other populations in Abilene. Can you tell me a little bit about that?
Be happy to, yeah. So in April, we actually launched our first outreach program where we're taking the medical care mission outside of the clinic walls, and we started the outreach program at the Salvation Army. And so how that came to be is, I haven't mentioned this yet, but we are so fortunate, so blessed to have some amazing volunteers that help us at the medical care mission in all kinds of different forms and capacities, from checking patients in to, initiating the initial intake, if you will. And also we have some volunteer physicians like Fred White, and another one is actually a local rheumatologist by the name of Dr. Udaya Kumar. So he's dual certified in rheumatology and internal medicine, and he has a special interest in caring for the homeless population. And so he mentioned this to me, I guess it was early part of 2025, that he would, love to start a program that was tailored towards providing medical care for individuals facing homelessness. And so, but he had a lot of irons in the fire, and he said, basically, he said, Brady, I want to do this, but I don't want to actually lead it. Can we partner together on rolling this out? And so that's how the idea came to be. And we've had a wonderful partnership with the Salvation Army where, They provide us with at least a couple of rooms, and we're there once a month. I believe it's the second Friday of every month. Dr. Uday Kumar, myself, and one of our clinical leads go there and provide our services basically on site at the Salvation Army. So we like to say, at times there are challenges for patients making it to the clinic. So we understand that, and basically we're trying to take the medical care mission to them and make sure that they're not avoiding their medical care needs moving forward.
It sounds like the needs who encompass who the medical care mission. I mean, it's a lot of different layers of society. Essentially, I mean, having that under $75,000 limit and uninsured actually does kind of expose to a lot of different populations, be it the dual family working household, even down to, say, a Salvation Army or a homeless population that is in the exact same needs, but are needing a great place to still have good medical care. Would you say that you agree with that, or any other ways that you guys are going to be trying to help to foster relationships with different populations as well?
I will say that this 2025 has been basically kind of a year of collaboration. We're so fortunate enough to be a nonprofit, non-government organization, community-based organization, if you will. And there's so many great organizations like us within the community that's likely serving the exact same population that we're trying to serve as well. And so we've had some wonderful partnerships and, arrangements in which we're informing one another of, hey, this person needs medical, or hey, this person needs a home, or hey, this person needs mental health type things. And so it's very rewarding to have that collaboration with other like-minded organizations that are serving the population of Abilene. And I will say that as far as our patient population goes, the demographics, kind of as you're talking about, are pretty far-reaching, if you will. It could be an individual that is facing extreme poverty, it's facing homelessness, or it could be an individual who, they're working, they're earning an income, and maybe their spouse is as well, but said income disqualifies them for governmental assistance programs like Medicaid, Medicare, but at the same time, their income doesn't leave them with enough margin to be able to effectively afford insurance. And so that right there, that coverage gap, if you will, that's the population that we're trying to serve, and ultimately, who we're about serving.
So Abilene being a little bit over 130,000 people, how many people within Abilene itself qualify for care?
How many do you think?
I'd prefer to hear it from you.
I gotcha. Now, so it's an interesting question, and it's something that I've been keenly looking into here as of late. So I'll start with saying that Texas, actually, believe it or not, ranks number one in the nation when it comes to the highest uninsured rate. So Texas and Taylor County, similarly, about 15 to 20%, almost 1 in every 5 individuals do not have medical insurance, and that's adults that we're talking about here. So 15 to 20% of 130,000, let's just call it 30,000. Okay. That's probably an accurate or close to statement, if you will.
So earlier in the year, when everything was kind of going along with Obamacare kind of rules, healthcare marketplace kind of things that were going on, but how is that changing? So with the current news as it is, as a lot of those things have been, we dealt with a shutdown over these issues.
Yeah.
How are we expecting for the population? Is that number going to be going up as far as who would qualify for care in the medical care mission, or go down in your eyes?
Sure. Well, first and foremost, I'll start by just saying that the needs are already very high. In that 15 to 20% of 130,000, that's a lot of people.
Absolutely.
And so we are doing our absolute best to get the word out, if you will, about who we are, who we serve, and what we do. And so we're already starting to really kind of work on that, develop a campaign strategy around that. But then at the same time, just as you're talking about, there has been a lot of headlines in the news over healthcare in the U.S. within this last year, and so I'll back up to the middle part of this year when the federal government passed the One Big Beautiful Bill. Part of that was some proposed a bigger focus on Medicaid programs, Medicare programs, making sure that, the right people had access to those programs and we weren't abusing the system, kind of a thing. And so over the course of the next 10 years, they're anticipating a lot of budgetary cuts relating to those programs. And, with increased work requirements, with increased eligibility requirements, with increased check-ins and things along those lines. So I say all of that to say that just by the nature of things, over the next decade or so, there will be potentially less individuals that qualify for Medicaid. And so just as I had talked about earlier, the uninsured rate right now is around 15 to 20%. In Taylor County, specifically, approximately 13 to 15% of the population are Medicaid beneficiaries. And so if that 13 to 15% all of a sudden lose coverage or can't access it for whatever reason, naturally they're going to be uninsured and increase that rate. So that's one of the big things that we anticipate will contribute to a higher uninsured rate. And then the second one is the expiration of the Affordable Care Act, aka Obamacare subsidies that are set to expire effectively at the end of this year. And so there's a lot of chatter about that right now, but just kind of backing up to the same kind of point about the percentages, if you will. So uninsured, 15 to 20%, Medicaid beneficiaries, about 13 to 15%. There's approximately another about 13 to 15% that are insured through these Affordable Care Act subsidized plans. And so if the subsidies expire on schedule by the end of 2025, a lot of folks will be looking at, per the most recent analysis that I've seen, are looking at substantial increases in their premiums to the tune of double. Somebody going from $800 a month to $1,600 to $1,900 a month. So by sheer nature of things, and especially the individuals that are relying on those plans, unfortunately, they may be priced out of it a little bit to where they just simply can't afford it. And so it's anticipated that if those subsidies do expire on schedule, that will also increase or contribute to further increase in the uninsured rates within this area.
Wow. How are you going to be able to build enough capacity? I mean, if you're kind of like quick adding on numbers, you're looking at 50% of the population.
Mm-hmm.
So if you were to start scaling up in basically a base of patients, what are the ways that the medical care mission is working to make sure that basically anyone who comes to the door who qualifies is able to receive help? Mm-hmm. How does your group work on that?
Sure. It's a great question. We're still trying to figure that out exactly. It's one of those things, a lot of these things that we're talking about, Medicaid potentially being cut a little bit, ACA plans being cut a little bit, uninsured rates going up, those are very likely, but it's not for certain.
Sure.
So it's kind of difficult to get the crystal ball out and kind of see the future as to exactly what will or what likely will unfold over the next 1 to 10 years, if you will. But with that, it's still worthwhile for us to say, if push comes to shove, we are going to need to act, because 100% we're going to be there for our own Abilene community, when the time comes. And so let's just say that, we do need to increase capacity and ultimately scale to meet that demand once the need is there. Basically what would need to happen is we would need, more staff, more providers, potentially expansion of services and things along those lines. And so when it comes to those types of things, you're talking about, what are your budgetary constraints and how are you going to overcome that? It might come in the form of people volunteering more because they determine, this community gives back in so many different ways. And again, when push comes to shove, we take care of our own. And so I would love we'd love to be able to offset that and expand on our services through promoting volunteerism through our medical community as well. And then on top of that, if we're unable to meet that demand entirely through volunteering, of course, we're going to have to look at increasing our staff and employed team ultimately to meet that demand for the patients in the community. And so that comes at the form of, requiring additional funds. And so something I always get asked about, how is the medical care mission funded, is a common question. And I always love to just say that, we are funded by Abilene for Abilene. And what I mean by that is we're very fortunate to be in a position to where we rely on zero federal dollars to operate, and 100% of the contributions to the medical care mission come in the form of local support through Abilene. And so, again, like I was saying earlier, when push comes to shove, this community will respond. And ultimately, I feel as if, the demand for medical services rise, that the community will further support us and our mission to deliver on that care.
Okay, so you say that funding doesn't come from government funds. We're not tied to anything like that. How is the medical care funded? Just kind of some nuts and bolts on how it works.
Sure. Yeah, so it's a great question, and I get that often. But the medical care mission, just as you're talking about, has relied on $0 coming from federal, and that's really nice because, of course, in federal turmoil, so to speak, we're still able to operate and not relying on any of additional funds coming from them. So one of the things I always love to talk about is the fact that we keep fees at the medical care mission incredibly low. And just as I had mentioned earlier, we never want financials to be a barrier for accessing medical care for the population that we serve. And so a patient of ours can come see a doctor for, on average, about $25.
Really?
And, another aspect of it is, the labs. We have some wonderful partnerships with local labs that give us a discounted rate. We charge patients, about $5 per lab on average. And then medications, we already talked about a little bit, average anywhere between $0 and $3. So I always like to say patients can come see us, get the labs that they need, get the medications they need, all for less than about $40, which is incredibly low compared to what you would experience elsewhere. And so, although we do charge patients a fee for those services, at the same time, it costs substantially more to deliver on the care of those services. So in order for the medical care mission ultimately to continue to operate, keep the lights on, if you will, we do have an annual budget that we need to meet. And of those all patient fees that we do charge, that only comprises about 10% of our annual operating budget. So then the natural follow-up question is, well, where the heck do you get the 90%? And so when it comes to that 90%, it is entirely through the community of Abilene in one way, shape, or form. And so we're incredibly fortunate enough to have a local community grant through Taylor County because we are a primary care service for individuals facing extreme poverty, namely through their indigent health care program. So with us being there providing services for that patient population, we do receive a grant through Taylor County for that. And so that is a good chunk of the 90%, if you will. And other than that, we continue to have the support of some local organizations that believe in our mission, believe in who we serve and what we do. And so they we're fortunate enough to where they donate or have some charitable donations coming our way as well. And then locally, we're also supported through the Community Foundation of Abilene, which gives us a great grant, as well as a partnering agency of the United Way, who also helps us in the form of grants as well. On top of that, we have a lot of different support through some, again, organizational charitable donations, but also individual charitable donations as well. And so there's that. And then last but not least, we do have some fundraising efforts year to year as well. That is something that we've ramped up a little bit over the last year or so, and we have a wonderful fundraising scheduled for 2026. And we're going to be doing a few fun runs as well as Tour de Gap in July. And then we're looking at some fun comedy night type banquet dinner in the fall as well. And so that's just kind of a general makeup as to how the medical care mission is funded, how we continue to operate, how we continue to provide our services for the community, for the patients that we serve. And so as I've mentioned before, we are Abilene's clinic and have been over the past 42 years funded by Abilene for the community of Abilene.
Fantastic. So if we're not worried about funding, we're not worried about being tied to legislation, what are you focused on for the next 5-10 years while you're the executive director of the organization?
It's a great question. Basically, we're trying to expand on the services that we're able to offer patients. We want to be a comprehensive medical care home for the patient population that we do serve. And so, a good example of that is dental care. So dental care has been an ongoing challenge in the community of Abilene for the population that we serve. Historically, the medical care mission did have a dental program until the dentist on staff actually retired. I want to say it was in 2018. And so since 2018, charity dental care, county dental care, if you will, has been a little bit of a challenge for the community. There are amazing programs through like the Christian Services Center and a few local dentists that definitely help. And we just want to be an added resource when it comes to that. And so in the future, we're currently strategizing on how we can ultimately bring dental care back under the services that we do provide our patient population. And that's a good example of us just trying to expand on services to meet the needs of the patients. Some other things that we're kind of looking at is expanding on our outreach program possibly. So of course, once a month we're going to the Salvation Army, and that's been fantastic. And we've really appreciated that. We also want to mention that, our service area actually is not only Abilene, of course, it's the surrounding community as well. Our service population is approximately 18 counties, so the majority of the big country. And so although that's the case and we can care for those individuals, we don't get a huge patient population from the outlying communities. And there may be some barriers there that they're experiencing that's contributing to them not being able to access our programs like transportation and things along those lines. And so, especially with my rural, small town upbringing, I understand what it's like to be in a medical desert, if you will. I understand having to travel for your medical care. So I would love to consider over the course of the next few years or 5 years, whatever you want to say, figuring out a way in which we can get into those outlying communities and take the medical care mission to them, so to speak. And then kind of back to a lot of what you're hearing in the headlines as well is a lot of concerns relating to rural health care, which, believe it or not, what is today, the 21st? Yesterday was National Rural Health Care Day. I don't know if too many people knew that.
No, not at all.
But so that is something that we need to celebrate, and those rural healthcare providers we need to support as well. And so a lot of them are facing some significant challenges, not only presently but also potentially down the road as well, when it comes to financial strain. And so a lot of that is ultimately because potentially, it's our opinion, but potentially a lot of those patients don't have access to affordable primary care, preventative health care that they need to prevent them from having to utilize ERs and things like that. And when patients that are uninsured access the ERs, oftentimes said ER goes unreimbursed, if you will, for the services that they provide, or they have uncompensated care is something that really struggles with in the rural world. And so all that to say is that, something that the medical care mission would love to start thinking about and strategizing on is how can we get out to these outlying communities and deliver low-fee, affordable health care and prescription assistance to some of our rural neighbors.
Would you also be willing to help people in those communities establish something like what you guys have been able to do. I mean, it's very difficult, I'm sure, to kind of start from scratch without a template for what medical care could be like in those communities, making another PMCM without kind of understanding how it worked and how it got started on its own. Would you be willing to kind of help some people in those communities start organizations like that if perhaps your fundraising doesn't go far enough to allow that kind of outreach?
Sure. Yeah, absolutely. If there are providers out there, there's medical staff out there in these rural communities that would like to consider, starting something like the medical care mission, by all means, we would be happy to support that in whatever shape or form that be. Something that I'll mention as well, and kind of thinking back to the differences between my typical medical practice versus like the medical care mission. With us catering to and caring for the uninsured population, it's so nice and so rewarding because, of course, we don't accept insurance and we don't accept, governmental payer insurance as well. And so basically what that means is that we're a little bit unbeholden to the insurance companies or the government insurance companies. And often, too many times, I see physicians and staff that ultimately they're seeing a patient, they're caring for a patient, they're trying to do best by that patient based on best practices in medicine, but the insurance company or the government insurance company tells them basically they can't do certain things, namely in the form of like restricting the medications that are available to them, restricting the providers that are available to them, and just too many restrictions. Time and time again, we've seen delay care and cause issues for patients that the physicians that are trying to do best by them. Wow. And so I say all that to say that the charitable clinic format, if you will, is just incredibly different to where I feel as if it's, the physician, can see a patient, but actually can make best decisions based on what they want to do and think is best by that patient in real time without having to worry about insurance companies and or government looking over their shoulder, so to speak. So it's an incredibly rewarding environment to work in and incredibly rewarding medical care delivery system that I think a lot of doctors need to know about and potentially consider, and especially in those rural outlying communities if they were interested in kind of duplicating our model, if you will.
Fantastic. What do you got going on here in the near future? What's coming up for you guys? How can people get connected to or support the mission?
Perfect. Yeah. So if anybody's interested to learn more about the medical care mission, by all means, the easiest way is to look at our website. It's simply www.pmcm.org for Presbyterian Medical Care Mission. So there's a lot of information relating to our history, our background, our current services, our current patient population, and everything there. So would, of course, steer anybody that way. When it comes to supporting the medical care mission, word of mouth is our best referral source, and so we would just encourage anybody and everybody to get the word out, talk to your neighbors, talk to your relatives, talk to your friends. If you know of anybody that doesn't have insurance, maybe on the lower income side, that needs medical care, we are a resource available to them, and we'd be happy to welcome them as a patient. So like I said, word of mouth is our best referral source, so please get the word out. We do not want to be Abilene's best kept secret. We want to get the word out and people to know that we're a resource available for them when the time needs. And then on top of that, we if anybody is interested in supporting the mission through volunteerism, we have amazing volunteers, and we very much promote volunteerism, whether that be somebody that's interested in helping us answer phones, helping us schedule patients, file old patient records, or potentially on the clinical side, if anybody is a former nurse or a current nurse looking to just be in a rewarding environment, by all means, the medical care mission would be great to look into. And then on top of that, physician volunteerism is another thing that we're actively recruiting for, if you will. So anybody that has a special interest in serving the patient population and being in a rewarding environment, I would encourage them to look into that. And please give me a call.
And potentially dentists, I'm sure.
Yeah, dentist as well. We're so fortunate. We're getting closer to the finish line, getting closer to the goal line on the dental program, namely because we have an amazing local physician who's interested to volunteer at least twice a month. So twice a month we think will be wonderful. That will be a huge starting point, but we do think it's going to be a starting point, and the end point is going to be to where we might need a little bit more full-time coverage, if you will. So dentists interested in volunteering, by all means, that would be fantastic. And then last but not least, if anybody is interested in donating to our cause, by all means, we accept charitable donations, and with us being a 501c3 nonprofit organization, all charitable donations are tax exempt. So if anybody needs to get their last donations in before tax season ends or tax year ends, by all means, we would welcome any support financially as well. And then I said last but not least, but one more thing. Of course, as I mentioned earlier, we talked about fundraisers. And so we have some great fundraisers that we're really looking at in the future. Namely, we have one that we're really excited about called the Undy Run 5K that we're looking at starting on this, let's see, it's going to be Saturday, March 28th. And this came about, the Undy Run is entirely a fun event that we're looking at to promote colon cancer awareness. The March is Colon Cancer Awareness Month. With colon cancer in the U.S., it's actually the third leading cause of cancer-related deaths in the U.S. And so we're so fortunate through our programs. Earlier I talked about preventative health. Through our programs, we're actually able to offer patients free colon cancer screening. That does include, of course, a test up front, as well as potentially through partnerships with like Tech as well as Hendrick, potentially free colonoscopies as well. Wow. So we're really proud of that partnership, that collaboration with these amazing organizations. And so we have to acknowledge that and promote Colon Cancer Awareness Month in general. We're looking to start an Undy Run 5K with an inflatable colon as your start and finish line kind of a thing. And so we're going to have a lot of fun with it. We're hoping that it will be able to pass by the First Central Presbyterian Church, which of course is where our namesake comes from. And so we're really looking forward to that. Would encourage anybody to consider it once you start seeing some promotions relating to that in the form of running, walking, volunteering, whatever the case may be. We would welcome anybody there. And then, like I said, we'll have some other great fundraising opportunities and just wellness events as well, such as like the Tour de Gap, which is a wonderful long-standing bike race here in Buffalo Gap that's going to take place on the 4th Saturday of July. So anybody interested to learn more, pmcm.org. Anybody interested in supporting us, please get the word out. Word of mouth is best referral source. Anybody interested in volunteering, supporting us through donations, as well as upcoming fundraisers. There's a lot of different ways in which people can get involved, as well as support us and support our mission of serving the Abilene community.
Perfect. Well, thank you for doing this.
You bet. Thanks for having me.
All right.